Hello, and welcome to The Mind of a Therapist, a podcast where I interview psychotherapists and helping professionals and what they're passionate about in order to provide you with messages of encouragement and hope. I'm your host, Andrew Earl. The Mind of a Therapist is sponsored by Psychological Counseling Services, healing hearts and transforming lives. Look into our intensive at pcsearl.com. In today's episode, I interviewed Gene Combs. Gene is co-director of Evanston Family Therapy Center, a small nonprofit training institution which focuses on narrative approaches to therapy. He is an internationally known author and teacher of narrative family therapy with a particular focus on social justice. Now retired from his work as a psychiatrist, he has a continuing skepticism and critique concerning current medical model practices in psychiatry and the influence of corporate capitalism on healthcare. So without further ado, here's my interview with Gene. All right, Gene, thanks for being on the podcast today. I thought we could start off by it's kind of a big question that I have, but if you were to give an answer to what would you say is like the spirit or the heart of narrative therapy?
You're right. That's a big question. The problem with this stuff that gets called narrative therapy, I think, is that it's any brief description of it sounds trivial in a certain way. But I was talking with my partner in everything, Jill Friedman, this morning, and we were thinking back to before we were narrative therapists. We really immersed ourselves in the work of Milton Erickson, and we actually met at a very advanced hypnotherapy training.
Oh, wow.
And somebody once asked Milton Erickson to define what psychotherapy is. And he said, well, it's when two people get together and try to figure out what in the hell one of them wants.
That's good.
And I was relating that to what we call in narrative therapy intentional state psychology,
mm-hmm.
which is really just not defining people or orienting to people in terms of some internal essence about them, not an internal state, not a you are depressed, you are schizophrenic, you are anxious, but rather orienting to what people's hopes, dreams, intentions, aspirations, commitments, where their heart wants to go, where their most precious longings are. And I think really, you ask what's at the heart of narrative therapy, I would say that it's trying to relate to people in such a way that they feel safe and secure and understood in saying to somebody else and therefore hearing themselves say, experiencing themselves articulating what they want.
Wow.
And then all the rest of it is sort of bringing forth stories of the struggle about what's getting in the way of that.
Sure. Uh-huh.
And that's where we get into all this stuff about externalization in narrative therapy and what are the the things in your relational context? What are the stories about what you can and can't do, what you should and shouldn't do, what's possible, what's not possible, what's right, what's wrong, that your strivings are coming up against?
Mm-hmm. Mm-hmm.
And how do we engage with that the stories of that struggle in people's lives to claim a meaningful life in the face of a context that has put limitations on that,
Mm-hmm.
that has pushed them in directions that don't suit them, that have caused pain or suffering or worries in their life.
Mm-hmm. Yeah. And imagining that looks, different for each person as to what that process looks like of creating a context that's supportive of them in, developing, moving towards what they want amidst this problem that they're contending with. Are there postures that you find that you take, other narrative therapists take, that are particularly supportive of people moving in those directions?
You just engaged my 12-year-old wise ass, and I found myself wanting to say, well, yes, I prefer the lotus position, but taking it more seriously. I think this is the hardest stuff to talk about. It's the hardest stuff to teach somebody that's more a teacher of narrative therapy than I do more teaching than I do practice these days, although I don't see them as all that different. But it's an open, curious posture in which you're striving to resonate with the person that you're there to help, or the family you're there to help, or the organization or the community that you're there to help, knowing that it's an impossible task, still trying to do your best job of putting yourself in their shoes experientially. And what happens in that process, I think, is the kinds of questions you have to ask, the kind of curiosity you have to understand it for yourself, leads the people you're working with to understand it in new ways for themselves, because they in order to orient you to what they're doing, so that you can understand it, they're looking at it in ways that they don't when they're not trying to get somebody else to understand it.
Sure.
We talk a lot about tellings and retellings in narrative therapy, and believe that there's, you can't step in the same stream twice. You can't tell exactly the same story twice. And that every time you tell it to a new person, there's a subtlety, a nuance that comes out that's fresh. And I guess that's another piece of the posture too, is to do what Michael White called double listening. To always be listening for the story the person wants to tell, the problematic story, what's wrong, but also listening for what lies outside of that, what wouldn't be predicted by that. Listening for the freshness, the newness, the possibility of something other than what they've had. You're asking questions that get me passionate. I hope I'm not.
Oh, it's good. It's good. That's I'm on track if that's what we're doing
here on you.
Well, yeah, I'm curious with I just lost my thought there. With that doubly listening posture, how do you gauge when to continue and creating space for them to talk about that, problem saturated story, maybe that more familiar story, or to move in the direction of that conversation that's like highlighting these new possibilities.
Well, let me go one step previous to that. Just describe a little bit for people that may not be familiar with what we do. That in an ideal first session with a family or a couple or an individual, we would want to spend some just getting to know them, just kind of hanging out with them as people. And sometimes that's if somebody's coming in the middle of a heartrending crisis, to say, well, what do you do for fun, might not be appropriate. But as much as it is appropriate to the situation, we want to not see people just as what's wrong with them, and we want to engage with them in ways that reminds them of that. So we'll, if at all possible, we'll want to spend a little time just finding out what David Epstein talks about as people's wonderfulnesses. Tell me about what you like about yourself. Tell me about what's fun. Tell me about what you do when you're not sitting talking about problems to a psychotherapist, because I want to know that side of you, because that's going to help me understand you in your fullness.
Yes.
So we will do some of that if we can. And then we will begin to say, well, but that's not what you're here for. You had some kind of problem that brought you here. Tell me about that. And then I think it's important to listen to that in some detail, because you can't spot what lies outside of the problem story until you understand the plot line and some of the, some of the richness, the detail of the problem story. And also, people will feel trivialized, feel like you're not, like you're making light of their problem, or you're not really understanding how bad it is for them.
Sure.
If you don't spend some time listening in some detail, and trying to understand in its particularities how it's a problem for them. So if somebody talks about something in a generalized, medicalized term like depression or schizophrenia or ADHD, we'll want to know, well, okay, so but what do you mean when you say ADHD?
Yes.
How does ADHD affect your life? What did this thing that you're using the shorthand of ADHD to refer to, how does it show up? How does it interfere with your relationship with yourself, with your relationship with your family, with how you show up at work? So we'll spend a considerable amount of time, but always as much as we can, then also listening for the things they say, like, often 2/3 of the way into telling a story like this, people will realize that, boy, I'm sounding really awful. And they'll say, well, it's not always that bad, and we'll listen close to that.
Yeah.
Or we'll listen for words like sometimes, which is just a clue that it's not all the time.
Sure.
Or sometimes it'll be something as small as a little expression that crosses somebody's face that looks hopeful, that we'll come back to and say, I know you've been struggling with this, and I hear that it's really hard, and we might even repeat back some of the words they've said. Again, both to let them know we've heard, and as a check to see if what we're understanding is what they want us to understand.
Yeah.
So we'll say that, and then we'll say, but I noticed that you had this expression that I don't know what you would call it. I would call it hopeful. And do you know what I'm referring to? Yeah. I think I know what what was your experience in that moment? What were you thinking, or were you saying something to yourself? Were you having a memory? What was going on there? but always looking for things that are little clues to other possibilities in their life. And then if we can engage people in an experiential revivification of that, we'll spend as much time as we can, as long as that feels meaningful to the person. And we'll try to help them re-engage with that, not just in a head way, but in a re-embodied way, to get back inside that memory and bring it into their current life.
Yeah.
Usually, when we give a brief description of it like this, it sounds more separate than it often is in practice. Often we're going back and forth from one sentence to the next between talking a little bit about the story and talking a little bit about something that's outside the story.
Mm-hmm, mm-hmm.
But over time, we're trying to build these alternative stories that are experientially vivid for the person, so that they experience themselves as more than the problem, more than that thing that brought them in.
Yeah. Will you say more about that experientially vivid piece?
Well, I think one of the criticisms that I hear from people that maybe did a narrative therapy workshop or did their obligatory one session on narrative therapy in their overview course or something like that, is that it's about language and it's about thoughts, and it doesn't engage the body. And especially these days, that's, that's all the rage these days is treating your nervous system like it's something separate from the rest of you, and like it's this pet that you have to nourish or something, or this thing that you haven't done, or there's articles written like, what do you do with the emotions in cognitive therapy or in narrative therapy? And but that's always seemed strange to me, because the person I learned narrative therapy mostly from was Michael White. And if you watched people in a session with Michael White, they were very fully emotionally engaged always.
Yeah.
There was tears, there was laughter, there was movement. And we believe that if it doesn't engage the whole person, then it's not going to get anywhere.
Yeah.
And I think that's another distinction we make in narrative therapy is that we don't work with thoughts, feelings, and emotion, thoughts, feelings, and actions. We work with experience. Mm-hmm. And when we say experience, we're talking about all of those things as an integrated unit.
Yes.
So we work hard not to separate experience off into pieces, but more relationally, more complexly, more interwoven with all of the various threads of people's experience.
Oh, that's good. Yeah, I like that.
What's good about it? What do you like about it?
That's a good question. Yeah, I think I like that it's not the expert therapist, if you will, distinguishing between emotion, thought, behavior. Yeah, when you were talking about Michael White too, and the transcripts I've read and the videos I've seen, there was this whole engagement, and he spoke to, people would often ask him at conferences, well, what about emotion and narrative therapy? And he was like, I'm always surprised by that question, because I had just shown this video where, him and the person consulting him are just in tears, and I'm drawn to it because it's really, I mean, the larger reason I've been drawn to narrative therapy is it's just this this deep honoring of uh, people's understandings of their experience, and so I think that that's what I'm drawn to. Is just so honoring of how
Mhm,
that
mhm.
person is coming to understand their own experience.
Yeah, well, I, certainly one of the things that's very important uh, to me as a narrative therapist and to the people I know and um, um, would consider to be narrative therapists that I would are worthy of the title is a wanting to be careful that what happens in therapy um, is that people get more and more in touch with their own sense of power, with their own
Mm.
sense of agency in their life,
Mm-hmm.
with their
Mm-hmm.
abilities, their knowledge, their skills, and that they don't leave therapy thinking, oh, what a wonderful therapist I had. He changed my life. They leave therapy thinking, oh, well, I, I got some skills. I got some knowledge. I can do this.
Mm.
Um, and it's de-skilling of people if they attribute what happened in the therapy to my expertise or to something magic I did.
Mm.
And I'm always wanting to try to engage people in a growing awareness of their knowledge, their skills, their abilities.
Mm. Yeah. Well, and I'm curious. I'm a therapist in training and
Mhm.
practicing with couples and families, and as I've been approaching work with couples, uh, I've found that it's been easier for me to work with individuals from the narrative orientation that I've been cultivating. And I've kind of, I've looked at a lot of my peers are into emotionally focused
Mhm.
therapy, and it's very, there's I think 7 steps or so, or different tasks, and it's pretty straightforward with how to approach work with couples. And so I'm wondering, from this narrative orientation, building upon what we've already talked about, are there specific considerations in working with couples, especially with couples that are higher conflict?
Yeah, we could talk for a long time about that, but um, I think the basics of how we think about working with couples are fairly simple. Uh, we don't try to instruct people about the right way to have communication or the right way to be a couple. We try to develop a space where the partners in a relationship can um, can can do what I was describing we do as therapists with each other,
Mm,
can listen to and understand the other person or the other people in the relationship's perspective, not necessarily agree with it, but understand it,
mm-hmm,
and to understand the the other person in the relationship's struggles. Uh, so a lot of the work we'll do in the beginning when there's a lot of conflict is to say we understand there's a lot of conflict, and we'll ask them to tell us some about the conflict, and then we'll say something like, well, so my understanding is that you're here to do something other than what you do when that conflict is there. Is that correct? And usually most people will say, yeah, that's what we're here for. So we'll say, so if the conflict starts to show up, is it okay with you if I intervene at
okay.
that point and suggest something different? And what we're going to suggest instead of the conflict is that we're going to talk to you one at a time for short bursts for a few minutes. And while we're talking to one of you, we want the other to listen and really listen. Listen, not to prepare your next argument, not listening for how they're misportraying you, or not to take what they're saying as an accusation, but listen the way you might listen to a good friend if they were talking about a difficulty they had with something. And can you do that? And is it okay if it seems to me like you're not doing that, if I stop and ask you and we do whatever you need to do to stay in that kind of place?
Mm-hmm. Mm-hmm.
Actually, when it's a lower conflict couple, we'll do all of that non-verbally as much as we can. We'll just start talking to people and noticing whether their partner is really listening or not. And we'll intervene only as much as we do, and we'll coach only as much as we need to help that person stay in a place where they're listening to this other story. And part of that too is to be interacting with the person we're talking to in a way that's as non-accusatory as possible. So to ask questions that don't invite accusation, and to ask questions that are bringing forth an interesting description of the struggle.
Mm-hmm.
So that it's something that the other partner can listen to and hopefully become engaged in.
Mm-hmm.
And in the ideal form, we would do that until there's something new on the table. So some little small step had been taken, and then we'll turn to the other person in the relationship. And we won't just say, what were you thinking, or where were you? We'll say, when your partner said that thing, that's the new thing, or when your partner described that step, what was it like for you to hear that?
Uh-huh. Uh-huh.
And then we'll engage with them while their partner listens. And again, in the ideal form, it's new step over here that's heard, which facilitates a new step over here that's heard.
Yeah.
Now it gets messy,
Sure. Sure.
And we have to stop and all kinds of stuff. But did you follow that? I mean, that's sort of the basic algorithm for working with couples, to the extent that we have an algorithm.
Oh, I appreciate that. And yeah, I'm really drawn to that, inviting that other person and asking, permission to interrupt, especially in the higher conflict couple, and then inviting, that listening posture, just purely listening, and then asking. So you're asking them what was their thought about this new development, new step or possibility that you've explored a bit with their partner.
Uh-huh. And it's usually a new possibility for the relationship.
Yeah.
That we're probing for.
Yeah, and that does that kind of align with what we were talking about earlier in terms of that posture of curiosity about their lived experience, and kind of doubly listening there for exceptions to that problem.
Yeah.
Oh, that's good. Well, I'm curious. What's been what have you been thinking about these days in the realms of narrative therapy, psychotherapy? What's been exciting to you?
Well, my current passion is more at the cultural level, and the way things that are happening in the culture show up in people's lives and in families' lives. So I'm the two things I've been reading and writing and researching and about that are sort of at my growing edge are whiteness as a white therapist and anti-racism and the way that we've just recently seen startling evidence of how white supremacy is still a value for something like half of our population, it seems. And the ripples that has for not just for black and brown and yellow and red people, but for white people too, to be either threatened about your place in society, or to be full of anger, or full of guilt. And the way these things show up, and trying to understand that and figure out what can we do to keep shifting our society so that that's not such a big oppressive force in all of our lives. And the other, to use a word that makes people's eyes roll a lot, I've been studying about neoliberalism, about economics, about the way ever since Reagan and Thatcher, for the last 40 years, the economic system that Western powers, not just the United States, have engaged in, is one that's tried to turn. It's about individualism, and it's about money, and it's about each of us conceptualizing ourselves as a mini corporation of one that's in competition with every other little mini corporation, and we measure our self-worth by how much more money we've got and how much more efficient we've been in generating money than all the other little mini corporations that we're in competition with. So there's and so it's just, and that affects everybody's life. Who do you know that's not overworked? Who do you know that's not at some level self-oppressed by the fact that they don't have as nice a car as they should have, or that's not worn to the bone by pushing themselves to work more hours than a person should work? And how do we find ways to talk about that and to engage around that open some space and that get back to some values that are about community and about basic things like love rather than wealth.
Yes.
About collectivism rather than individualism. So those are the things that I wake up in the morning thinking about how what more can I learn? How can I learn to talk about that with my students? How can I learn to talk about that? How can I learn to help people who come to me for help, for psychotherapy kind of help? Kind of pull the curtains back and understand the influence of some of these things. And so much of what we do in our culture now is put an individual diagnosis of anxiety on something that should be labeled, pushed to be afraid you're going to lose your job because you're not meeting unreasonable standards at your job.
Yeah.
To throw, or somebody's, got something that gets diagnosed as depression and gets an antidepressant pill thrown at it. When you look at the larger context of their life, they'd have to be crazy not to feel sad.
Yeah. Yeah, absolutely.
And how do we find ways to not just kind of foam at the mouth like I'm doing with you about it, but in very small but relevant and meaningful steps help people engage with wherever that's impacting on their lives and claim what power they can to put the blame where it belongs rather than feeling like something's wrong with them, to think, well, there's something wrong with my workplace and maybe I could have a little power to shift that.
Mm-hmm.
There's
Mm-hmm.
something wrong with the way my neighbors treat me. And I could get in league with some other people that would support me in that belief. And I don't have to feel like it's me that's the problem. It's the community I'm living in and the way they think about people that look like me.
Yeah. Mm-hmm. Oh, a lot of curiosities there as you were talking. One was around the that white supremacy piece that we see very present in our society currently. Have you found ways of engaging in conversations around white supremacy in training clinicians, or engaging personally with white supremacy as you see it, that have been generative?
Well, I have lots of people I'm talking with it about. We have Jill, my partner and everything, and I uh, have an online once a week group where we meet with. I think there's about 13 people involved in the group. It's rare that all 13 of us show up at the same time on the same day, but there's usually 6 to 8 of us that are talking for an hour and 15 minutes once a week about just what can we do. And I saw this person last week, and they said this horribly racist thing, and I didn't know how I could engage with that, and then to brainstorm about, well, what how could you engage in a way that gets somewhere and doesn't just turn into a fight, or some of it's about how do we engage with our family members that
Yeah.
have different views about us. And I wouldn't say that I've got any great one size fits all solutions that I could offer anybody about it, but I do believe that just the engaging around it,
Mm. Mm.
And knowing, yeah, here's the piece: is having like an accountability group, that there are these people that I'm going to have to come back, and that I can. It's both sides of that coin, that I can come back and talk about my struggles with it, and that when I'm in that difficult moment where I've got a choice to make, I'm thinking, how can I comport myself in this moment so that those people are going to approve of what I did, are going to
Mm.
are going to think I didn't just wimp out,
Mm.
or are going to understand what my struggle is,
Mm.
and what can I at least bring back from this moment that'll help us chew on it a little further.
Mm.
But it's a huge problem, and it's a difficult problem, and it's such a polarized problem that I think
Yes.
the steps we can take in the face of it are usually little bitty steps, but the important thing is to persist and to not
Yes.
ignore it and to not
Yes.
back away from it.
Yes.
You're nodding like I'm making sense.
I'm I'm
I
re-
sound like I'm just going so cosmic. It doesn't make any sense at all.
I'm really drawn to that persistence piece personally. That's
Yeah.
been a big theme in I think my family's life is the persistence. It's something I think I learned as
Mhm.
a younger person in the face of injustice. I have Quaker
Right.
roots, and I think that
Oh,
that
okay. Well,
that's
you would. You don't have to say any more than that.
uh-huh, yeah. But that
License.
that small step, I think yeah, these conversations can seem so polarized, so feudal, especially with family. I have so many friends who uh, talk about how challenging it is to talk about racism, white supremacy with family, along with many other political topics. But yeah, I think that creating that space where the conversation can happen and there's not that defensiveness, and being persistent, and then having that group too. I was really drawn to that with I was thinking of like the narrative concept of the club of life, and having those supportive people that are encouraging you in the direction of maybe justice in this case, who you have to continue to lean on and receive encouragement with. Um, well, Gene, I think I could go on in conversation with you for another hour or so, but we're coming to the end of the interview
Yeah.
here, and the question I like to pose at the end of the interview is, what's a message of hope that you'd like to leave the listener with?
Now I know how Krista Tippett's guests feel at the end of her show.
uh,
uh, uh, you know, um, well, I'm thinking of my mentor, Michael White, and so what I can't paint for you is the expression that would have been on Michael's face and the posture of his body when he said it. But he would often say, there's always more. And in the context in which he said it, it was there's always something outside of this is not a dead end.
Yeah.
This it may seem like there's no place to go, but there's always more if you look close enough, if you listen hard enough. And I think that's what this quest is in narrative therapy is to believe that and to develop a skill at believing it hard enough that you notice it and that you inquire into it, so that that little speck of whatever more is. I was a science major, a biology major, so I always think about going up to the next power on the microscope, so that it didn't look like much, but you put that bigger lens on, and oh my God, there's a whole world in there.
Sure.
So yeah, there's always more.
That's good. I like that. Thank you.
You're welcome.
And then if people are drawn to your work, where'd be a good place to direct them?
A too long website title. It's Narrative Therapy Chicago, all one word, .com. NarrativeTherapyChicago.com.
Perfect.
And yeah, you'll find lots of links to what we do and everything there.
Perfect. Link that in the show notes. And then is there any other place that you'd want to direct people in terms of online resources?
Yep. There's narrativeapproaches.com, really well curated website by Dean Lobovitz. What's Peggy Sachs's website? You would probably know it. It's something learning.
I don't know off the top of my head, but I'll look it up, and I'll link that in the show notes.
And then the Dulwich Center's website. knowledgecenter.au.com, I think it is. And
Yeah.
it's RE Center, the British spelling of center, not ER.
Perfect.
Those are the places I look first.
Perfect. Great. Well, thanks so much for being on the podcast
Thanks,
today, Gene.
Andrew. I really enjoyed the conversation. I really did.
Please press the subscribe button, as well as rating and reviewing our podcast. This helps others connect with what you've been hearing. If you have any questions, please contact us at themindofatherapist@gmail.com. These questions will be kept anonymous. I want to thank Eric Price for the wonderful music you hear in this podcast. Additionally, this podcast was created to provide accurate and authoritative information on the subject matter. Although we are interviewing licensed therapists, they are not your therapists. This podcast is not intended to serve as direct medical advice and should not be used as a substitute for direct professional help. It is given with the understanding that neither the host, publisher, guests, or PCS are rendering legal, clinical, or other professional information. If you need a professional, we encourage you to find one. Visit Psychology Today to connect with a licensed clinician near you.